All right. Hi, everybody. Welcome to another session on the work that we're doing with regard to the National Hispanic and Latino Mental Health Technology and Transfer Center. I'm Rocky Romero. I'm very honored to be here with Dr. Velez Echevarria and really being able to help you explore some of the issues relative to family therapy. The title of our presentation for today is a culturally sensitive modality when working with immigrant Latino families. So I'll be giving kind of the background, the broad picture of the information that we've collected and put together for you all, and then we'll turn over to Dr. Velez Echevarria and let her go into more of kind of the application and really giving you some potential techniques to consider as you work with Latino families and children. So let's go ahead and go on to the first slide here, and we'll look at our kind of goals and objectives for this presentation. So the objectives, again, identifying, and some of you that have attended our sessions before, thank you for coming back to another one of our webinars. For those of you that are new, I think the information on the first couple of slides will kind of help you get some background in terms of the cultural elements that we infuse in many of our trainings with the Mental Health Technology and Transfer Center. So the first objective is to identify those cultural values that we must consider in order to create a connection with individuals and families in therapy, specifically with the Latinx population and Latinos. We want to definitely discuss family-centered approaches, which, as many of you know, many of the interventions when we look at adolescent work is inclusive of the family system. So we want to make sure that we're doing that in a culturally appropriate way, and really considering some of the strategies, again, that we've outlined here today that we think will and it's proven that will help you get down the road with families a little bit easier, as easy as can be, I guess, given that family is, as you all know, one of the modalities that's very sensitive, and you really have to be aware, and it can be hard for folks that maybe not trained in that specific area. The third objective is we want to look at address competencies, again, of culturally responsive family therapists. So we want to give you guys the tools, and if you're kind of at the beginning stages of this work of cultural awareness, just getting out of school, maybe graduates, and I'm very excited. We have probably about 7 or 8 different professional backgrounds that we surveyed with you all that are in attendance today. We have close to 369 participants. So we want to really cover kind of a broad picture and then whittle it down, and trying to hit the target kind of in the middle so that we're not talking over folks that may not have the clinical language, but really being able to arm the therapists that do have that clinical training to be able to apply this. And then the last one, discuss a case, and that's what we'll have here at the end, that illustrates the application of structural family therapy with a young Mexican girl and their family. Next slide, please. So some of the concepts that we look at when we're talking about cultural values, one is familismo or familism, a cultural value frequently seen in Hispanic cultures, again, and it really kind of encompasses the family unit, and the values that fall under that more specifically can also be looked at as respect, support, obligation, and be able to really reference and call collectively as a family together some of the experiences that they're having. Definitely has been implicated as a protective factor when we talk about familismo for families, where they may have extended family, they may have immediate family, and those are things that we have to consider in terms of the extended family as well, that may impact and support young Latinx populations as well as families, and we'll talk more about that as we get down the road here this morning. A lack of familialism has been identified as a risk factor, so contrary and kind of in the opposite sense of familismo being a protective factor, if we're not encompassing that in our intervention and our approaches, it may be actually considered a risk factor. And if families don't have that, hence the need for potential family therapy and to bring folks in and maybe create that family cohesion if possible. Next slide, please. So some of the measures that you can kind of look at when you're, actually writing out treatment plans and looking at measurable goals and objectives. These are some of the, and as many of you know, sometimes measuring culture, measuring hope, measuring spirituality, some of those things that we consider connected to the family structure. This kind of gives you some ways to be able to do that in a not so descriptive way, but more kind of broad in terms of looking at the structure of the family, who's involved in the family. So for social workers out there, looking at eco mapping and those sort of tools that really help us to identify who is involved in this young person's life, what family members are strong connection and support and potentially can add to protective factors, and then what family members may be toxic, maybe we don't want to include, or that we want to involve in family therapy in some way to help resolve some of that toxicity that may be going on between siblings or between parent and child conflict. Behavioral attitudes, so behavior and then attitudinal. So behavioral, we want to look at what behaviors have changed since the intervention started, right? If you're looking at maybe the initial referral was sent to the school social worker for truancy, or the child was not showing up to school, well, then that begins to be one of the measures that you start to look at and request attendance reports from the school periodically so that you can see if that change, if that behavior change has been made given your interventions, working with the family, bringing them in, talking with them, adapting your approaches to be culturally appropriate, and if that's seeming to increase attendance at school. And again, we know there's many other factors, but I'm using this as one example. And then attitudinal changes. If initially you're seeing some ambivalence, or you see the adolescent unwilling to engage in family therapy or in treatment, but after several attempts in the first few sessions that you meet with them, you start to see the family's attitude or the individual child or adolescent's attitude change towards the approach and the therapeutic alliance that you're trying to build. So really starting to look at those three aspects can help you measure some of these cultural values that we're introducing to you all today. And some of you, of course, may be well aware of these as well. Next slide, please. So again, cultural values that kind of break it down a little bit more, as I spoke to the last slide, respect, personalismo, or giving people time and talking with them. And as we've talked before, when you're doing intakes and you're doing assessments with clients that are of Latinx populations, many times in a medical model, it doesn't allow for the platicar, or the conversation, the let's talk over kind of general things rather than jumping into very specific and maybe even personal and private things like sexuality, sexual identity, sexual preference, frequency of having sex. I mean, things that we as therapists sometimes don't think are invasive, but to families that are still very bound by cultural values like we're talking about, sometimes those can impact the cultural alliance and the relationship initially. So gender roles, again, understanding that sometimes families that you're working with, and when we look at Latin American communities and Latinx populations, a lot of times it's a matriarchy system that has evolved into patriarchy because of colonization and because of some of the other factors that have been introduced to traditional indigenous and Latin families, where prior to, as we all know, if mama ain't happy, ain't nobody happy, right? So sometimes the matriarchy is still very well alive, and we assume, because we're westernizing our clients, that they're taking on more of a patriarchy, and we approach things through the male, where many times it may be the opposite, and we have to really be sensitive to inquiring about kind of that family structure and gender roles within the family unit. Spirituality, and again, we're not trying to kind of make a blanket statement that kind of covers religion. More of this is the spirituality piece. If somebody in your families that you're seeing, one individual is starting to practice Buddhism and the other family is much more Catholic and you know, connected to that, there's then sometimes that we have to really talk together to see what are the similarities in what draws each of the individual family members to a certain spirituality. And then there's, again, when we talk about extended family or community, protective factors may really also be relative to healers in the community that a family may see or that grandma may see or mom may see, like curanderas or healers in terms of indigenous populations, you know, medicine men or women. And we also have to just be aware of other non-traditional providers and such that sometimes we just focus on the medical model approaches to providers, and we have to keep a broader view of that. Next slide, please. Some of the cultural considerations is the acculturation gaps, and this is huge. Again, I talk about this a lot in different trainings, especially the adolescent Latino gang training, but it's very important for family therapy as well when we talk about acculturation gaps. Acculturation gaps meaning that sometimes when family members of different generations, let's say parents or grandparents raising grandchildren, immigrate to this country, or even with my mom is going through it right now where she's a grandparent raising my great niece, and in that case the acculturation gap for her is pretty big in terms of my niece having much more awareness of social media and having access and having all this different discourse thrown at her and being influenced by that to a degree. Whereas my mom is not so technically inclined to really go into some of these social media sites. And so that's one that we can see with people and families that are from this population, the Latin population, but maybe third or fourth generation already here, right? And then we see those that are coming first generation, just immigrated to this country. There's going to be pretty significant acculturation gaps, given that the young people that are going to school acculturate to Western society and American society much more rapidly than the grandparents or parents. Acculturative stress, again, I think that adds to that, what we just spoke about. Language among family members, you know, it becomes very difficult at times when, and I'm sure many of you have seen this, where the young person, adolescent or child speaks English and Spanish, and you know, very naturally becomes the interpreter for family sessions. That should not happen, and ethically we have to be aware that you know, we have to utilize our resources. We have to use our insurance companies, our HMOs, those that can provide an interpreter service for you if the family does have that. If not, it's our responsibility as agencies, especially based on class standards, to provide services in the language of the clients that we serve, especially if you're receiving federal funding. So those are some of the kind of non-bendable aspects of, again, providing service. And I know it's difficult, believe me, I know it's hard sometimes to find the interpreter component, but we have to use our resources. And again, the MHTTC out of Puerto Rico can be an ally for you and a resource if that's something you need help with in developing that component, recruiting people to work for your agencies that do speak Spanish, or contracting with an agency that can provide that service. The immigration journey may be very violent for some. We see, you know, from South American communities in the Triangle, and those folks that immigrate have very different experiences, say, than people that are immigrating from Mexico to the United States. Violent in many aspects, which is very similar, but there's also the recruitment and the pressure from gangs, from adult gangs. There's also pressure and recruitment from the coyotes, or those individuals that you know, have a ransom set or pay people to have family members taken over to the United States. And then we've heard such cases where those family members may be held for ransom, may be used as sex workers and put into really bad situations. So really engage and discuss the immigration journey that you're engaging with, those clients that have had that, to understand fully what they've experienced. Typically what we've heard is there's a lot of adverse childhood experiences, obviously, that happen on that immigration journey, and we have to be aware of that. Parenting styles according to values. So sometimes those values may shift or change as immigration happens. At times, families may come to the United States wanting to hold on to rules or expectations that they had of their child in their home country, and here socially being different and expectations and things being different. Sometimes the parenting styles don't align with and it's not to say that it's wrong or it's right or any of that. Sometimes there's just a misalliance, and I think through family therapy and those interventions, you can help people compromise on the parenting styles, and also give family members that may not be used to their kiddos being on social media, may not be used to the young people in their lives being out and about in society that, and in a new country that they don't know. I think also, and rightfully so, in the climate that we're experiencing today, with the leader of our country in the United States promoting an us against them dichotomy and promoting an alienation of people of color, alienation of Latinx communities, parenting styles may be very much a helicopter parent approach to where they're trying to protect their young people from racism, from violence. And that may not jive with and align with the young person's wanting to be social and wanting to go out and wanting to experience American society like their counterparts, which may not be children of color, and they may not have the same worries that we have as Latin parents and Latinx communities. Next slide, please. So one thing that we want to make sure of also, again, as we start to look at family-centered interventions, the family system, we have to assess both risk and protective factors, and I think that's important. Either doing a list, the SIFTA intake a tool has that, and we're going to introduce that here and talking about that a little bit. And then it's really developing strategies to help address those risk factors and protective factors. And also within that, identifying what serious problems, either mental health, substance abuse, underlying acculturation issues, and or underlying attachment issues, because we know that some families that immigrate to this country sometimes are separated for long periods of times, and many young people that have experienced that break in their family unit during immigration may experience attachment issues, and we have to address those. Not surprisingly, we always have to understand that I would say 90% of the empirically supported interventions looking at treating children and adolescents have the family component. So we have to talk about family intervention. We have to arm ourselves as therapists and providers with the best skills that we can in order to address those individual needs, but also broadly the family needs, even more specifically as we kind of get down the road with you know, the issues that we're facing today from Latinx populations. Next slide, please. So family-centered interventions, again, these really focus on maximizing interventions relative to the communication, relative to building bridges, reconnecting estranged members of the family. Like I said, maybe there's a break where mom or dad, either depending on the situation and who can get work and who can be most productive as they immigrate to the United States. Sometimes father or mother may immigrate first before children. Sometimes we've seen children have been sent over first to live with family and maybe even friends or extended family in the United States. So sometimes there's a gap in that. So family-centered therapy and interventions can help reconnect that estranged family unit potentially. It can definitely address conflicts, but let's talk about the positive aspects of family therapy as well. It can also really, for looking at this from a strengths-based perspective, it can really maximize protective factors. From a very broad kind of start of saying man, you guys made it here safely and you're here, and you know, those are strengths that many people sometimes we pass those over. And I think we have to spend time, if we're building personal relationships and familismo with clients, we have to validate that experience that they've had that many of us may never experience. And I think that's important to validate. Definitely addressing the generational and acculturation differences that may exist are key in family-centered interventions. Next slide, please. So SIFTA, I jumped the gun. Culturally sensitive family therapies for Latinos. The first one that we look at is multidimensional family therapy. Again, there's also multi-systemic family therapy, MDFT or MST. Those models are very intensive and very much put a lot of demand on the therapist to follow and track the client and the family, visit with them at school, visit with them in social situations, visit with them at the home. So it can be very intense. Many of you are I'm sure familiar with brief strategic family therapy. This can be therapy that really focuses on perhaps the crisis that's happening at the moment. Perhaps we're looking at addressing hierarchy of needs relative to housing or food, or you know, getting parents connected to jobs. Those sort of things, when we look at brief strategic family therapy and or crisis, may be the focus within that model. And then SIFT, a culturally informed and flexible family treatment created by Dr. Santesteban out of the University of Miami, and really a good tool to use to do initial assessment with Latin families and even other groups of color, where we're really looking at informing our approaches culturally to make the best decisions for the family. Next slide, please. So now, again, selecting the treatment model, kind of giving you the breakdown of 3 or 4 that you can look at. And then again, we have a reference page at the end of this presentation where you can go to and see other references to those models that we mentioned. The similarity between the population you work with and looking at the original sample size that the model is treating, right? I've seen very few, SIFTA being one of those, that is considered, again, culturally appropriate in the sense that they've done their work with those groups of color to show the effectiveness in their research data, and specifically with their sample size. Others don't do that. They do it with populations that primarily they have access to. And again, that may not be groups of color. So one thing that the National Hispanic Latino Mental Health Technology Transfer Center can help you do is culturally adapt these models to meet the needs of your population through infusing culturally appropriate values that we talk about, and family approaches that we think will help you connect with families, like we talked about, familismo, respeto, etc. Definitely looking at bullet 2 here, completeness and detail of the treatment manual. Have they developed a manual? Is it in only right now in you know, peer-reviewed studies? Where is it in the process of becoming actually an evidence-based treatment? And is it manualized? Is that something that you need and you seek out in terms of guiding your approaches and your interventions? Always be considerate of what is the level of training, and not only the level of training, but education and supervision for a model. Some are very intensive and time consuming, and sometimes they don't fit well within a Medicaid reimbursement model, unfortunately. So with some of the models, if you are really committed to it and it makes clients outcomes more successful, and you're seeing that, as you all know, as directors and leaders, sometimes we have to eat that cost in order to really implement a model that we know is going to get clients better and help clients you know, produce positive outcomes. And then again, I think supervision is key. We're looking at that right now with, I do training out in McKinley County in New Mexico, and I also provide clinical supervision to the counselors out there due to the lack of LCSWs or independent licensures out in that area. And we're utilizing the matrix model for intensive outpatient treatment, and that does require intensive supervision. So we've had to go to now, especially because we're looking at COVID-19 restrictions, we've had to utilize a telehealth model, and me being able to visit with our therapist every 2 weeks and provide supervision as needed to them throughout the month. But those are models that we can help you adapt and really assess how that is going to fit with your level of staffing that you have. And then lastly, the level of counselor therapist. Again, are they LCSW? Does the model require that? Does it require more of a peer model approach or peer level approach? And those are things that you'll just have to determine as you adapt or adopt the model that you choose. Again, everything that we do for our Latinx population, I get tired of historically agencies or government-funded agencies doing the bare minimum for our people and people of color. Our people deserve a higher level of standard of care, and we demand that, and we encourage, and we're here to support you in that. We demand and we expect people to have high levels of fidelity to a model. And those are things that I also do as part of my consulting business, is we go in and help ensure that agencies are meeting the model that they have adopted to the fidelity of the research that has been shown to be effective. And that's sometimes hard if your model doesn't match the population it was studied under. So we have to adapt it, and those are things that we can help you with. Next slide, please. So some of the competencies that we see or that we know are important for the therapist, and again, not only for couples, but also, again, more specifically family therapy, being able to develop a systemic formulation. So again, are we looking at eco-mapping? What are we doing to really assess what the community impacts and family impacts are for the client in the center of that eco-map? Or, in counseling, if you do it differently, what does that look like in each of your different professions? But being able to systemically look at what's causing some of the behavioral attitudinal issues that we spoke about earlier. Second bullet, forging a systemic therapeutic alliance. So taking the time with familismo, with respeto, having some cafecito with the grandmother and with the mom and with dad, if you can get family members there, really trying to just build a relationship with them, not just a medical model where we're here to treat you, you have 15 minutes of my time, and then you're on to the next one. Understanding family of origin issues, acculturation, as well as immigration. Definitely looking at the reframing and managing of negative interactions. Like we said, there's been a ton of negative interactions and experiences from people who have immigrated to the United States. Violence, sexual assault, homicide, all these things that we don't necessarily see and sometimes may not know and understand. How resilient are the folks that have experienced those things and are still sitting in front of you? Validate that experience and that journey for them, and let that be, in some respects, a source of strength. Building cohesion, intimacy, and communication. I think we talked about that with cultural value-based of respect and familialism and all that good stuff. And then last bullet here, restructuring and parenting. So sometimes, as Minuchin used to do, is really look at the family structure and moving people around, even in a family therapy session, putting labels on the chairs of the family member's name where you want them to sit after you've initially seen them choose the setting that they want to sit in. Sometimes you see alliances between siblings, that you see siblings paired together that are forming an alliance maybe against the mom, who is the matriarch of the family and takes kiddos to all the appointments, takes on a lot of the disciplinary role, etc., where dad may be working, dad may not be able to be there, or in some cases maybe dad is absent, or reverse, mom is absent. We have to restructure that in a way that we're creating alliances between family members, and we're also seeing which alliances are toxic and potential triangulation with other family members. And again, much more to restructuring in the parenting aspect, but I hope you get the sense of what I'm talking about in terms of forms of communication, power, and alliance, and what that family structure looks like with those three things that we talked about. Next slide, please. So the other thing is looking at family therapist competencies. We've kind of hit on this already. Is looking at it from kind of how do we really adapt and approach immigration and acculturation? How do we adapt the models to include that? How do we, again, look at this from a strengths and protective factors based on the journey that people have experienced? And sometimes we have to really understand that, and it talks about that in the bullet, third bullet, I guess, strengths and protective factors that may be active or dormant in the Hispanic and Latino family and can be used in the recovery process. Sometimes, as you know, grief and trauma can be dormant as well and be triggered by an experience that a young person has in school, in the community, with violence, with bullying, with other forms that may trigger a dormant trauma echo, if you will, in that person. And those are things that you really have to assess, and SIFTA helps you with that, again, for adults, and you can adapt to the culturally informed intake that's a part of DSM as well, that really kind of looks at these things and even adapt, that to your own intake, I think is important to consider. And then looking at family expectations and values, and how do they align with kind of the expectations you're setting in the family sessions and family therapy process. Next, please. So culturally responsive therapists. In a nutshell, we attend to defensiveness, right? We don't just kind of pass it over or sweep it under the rug. We address it, and we talk about that. If one child or one family member, and sometimes I defensiveness and resistant and denial even are sometimes terms that I feel give people of color kind of a negative negative picture in the clinical file, if you will, for others that are seeing this and are treating them. And it may be, are they experiencing ambivalence? And can we not immediately pathologize when people are experiencing ambivalence? And don't get me wrong, if we move down the road and get through those first layers and they're still defensive and they're still resistant and in denial, then of course we clinically address that as appropriate. But I think sometimes families from Latinx populations, especially those that have just immigrated to this country, there's a certain amount of ambivalence, and once we can help them resolve that ambivalence, chances are we can help them move through motivational interviewing and other approaches. Explore the pain and lost time associated with separation, if you do have that process during the immigration that the family and individual has experienced, and then share questions and stories to help them move forward and reconnect. If you have other clients, or if you have an ongoing support group for immigrant populations, those are times to infuse some of that work into that as you're moving people through family therapy. I truly believe in individual therapy and family therapy. People shouldn't be in therapy for forever, right? And years. And don't get me wrong, some people may need that stability and that ongoing support, and it may be more intensive, especially if it's based on a significant mental health disorder or diagnosable disorder. But if it's just that the family needs ongoing support, maybe we move them out of family therapy into once a week social support, or once a month family social support kind of things, similar to the way the matrix model kind of has that family support component. And many other models, I think, can be adapted to include that. Let's go ahead and go on to the next slide, please. So culturally responsive therapists, again, really look at the acculturating and balancing new world and old world. And I think helping parents develop a blueprint is very important. They don't come with that, right? And parenting in and of itself, as many of you know, doesn't come with a blueprint. We may have dummies for parents or those sort of, self-help textbooks or whatever, but it really is trying to help families identify their protective and risk factors, creating interventions that will help address those, and then trying to help support them to resolve, those conflicts or traumas may take a while, but helping them develop a blueprint is key. Acculturation definitely could be associated with less effective types of parenting practices. And that just may be based on different stressors that this family had in their home country compared to here. And we have to just assess kind of how those are different, or is there similarities that we can build upon. But usually we see that when parents have immigrated from to this country and they also have teenagers, sometimes the parenting may be less inclusive and less structured, given that they didn't have a lot of the risk factors that we have in our country here in the United States, in their home country. And so we just have to really assess that. And I think that's it for this slide. Go ahead and go on to the next one, please. So consider the parent-child conflict. Again, acculturation related issues. We've talked about that. I've seen, and you can have families that have similar experiences, but usually every family I've worked with or talked with that has immigrated here has a unique story of their own, and it's up to us to really help them to talk about that to a degree. We're not wanting to re-traumatize in a way, but helping us to understand is definitely key in order for us to help resolve and successful outcomes. I mentioned this again, and so this is a reminder. As young people immigrate to this country, they acculturate at a much faster rate than their parents or their grandparents, and that has to do with social media, has to do with these little supercomputer phones that we have in our pockets, has to do with their exposure to many different cultures and different impacts socially than they may have had, again, in their home country. And those experiences may take on new values, beliefs that may contradict some of the behavior or parenting patterns that the young person was experiencing, which again may cause a clash in parenting approaches. Next slide, please. So again, looking at those two factors, attachment and immigration related processes, really consider and identify what was the separations that the family was able to identify and share with you during the immigration process. Was there adverse childhood experiences that were being experienced? Was there the adults that were immigrating, were they being targeted and experienced violence and other things? And then again, what was the immigration pattern for the family? Did parents immigrate ahead of children or vice versa? Was there disruption? Was there, disconnection completely from family members? What was that like? So help them kind of create that picture for you so that you know how best to intervene. Next slide, please. So another note on familismo. We want to make sure that we don't get overwhelmed. Sometimes as therapists, we may be even younger than our parents or our grandparents that we're helping with the family. And I speak about that given that I've had that experience, and at times feeling overwhelmed, like, what do I have to share with parents that are older with me that have done have much more experience. But don't sell yourself short on the skills that you have to bring in effective communication, clarity, and family structure. And when you have that ability, you then don't feel overwhelmed. And the reason I say that is because extended family and big families, so sometimes you can have 4 or 5 family members that show up for this one adolescent client. Try not to feel overwhelmed by that, but see that as a positive influence and something that you can use to your benefit to draw alliances with. Abuelas and abuelitos, grandmothers and grandfathers, aunts, uncles, tias, primos, and tias, really looking at targeting and activating that support network in order to support this child. And also it helps to really then recreate or reconnect the young person that may have drifted away from cultural values that they had in their home country and within their family because of the immigration and because of acculturation, it may allow them to reconnect with some of those family values that they've disconnected from. And then, as you all know, each family member within a family structure plays, or a family system plays, specific roles, right? Sometimes there's the joker, and sometimes there's the scapegoat. Sometimes there's the influencer, the one that really influences people. Like George Lopez always talks about, right? Sometimes there's the team leader, that maybe it's the person with some sort of degree in education, and or someone that just really speaks good English and can communicate effectively. So there's always these different roles that we have to really identify and be aware and understand and ask, is each family member happy with their role, or have they been defaulted into that role by family? And maybe they don't like that. Maybe they don't like being identified as the black sheep of the family, right? Or the one that's always in trouble, the scapegoat. So having that conversation and discussion is key. Let's go on to our next slide, please. So some of the other factors to consider when we really are looking at successful outcomes, better outcomes, is the engagement. I can't stress enough how important the engagement process is with Latinx and Latin populations. Retention. So it may take a little bit to build out that respect and familismo, but really engaging them and inviting them. Sometimes, like I've said before, and it's just kind of a nuance as I see it with families that come from the Latinx population, is sometimes we tend to want to step back when our loved one gets involved with a professional, whether a doctor, psychologist, social worker, therapist, whatever the role may be. As family members, sometimes we say we're going to step back to allow the professional to do their work, and to, not get in the way and upset that, where it's the exact opposite of that, right? We have to be able to tell them that they serve a very important role in the support and successful outcomes of their loved one if they're involved in family therapy. So it's inviting them, engaging them. Sometimes we've gone as far as sent out family therapist therapy invitations, like an invitation to a get-together type of thing, where this is important, you're invited to this, and make them feel comfortable at your agency in terms of being welcome and creating alliances through that therapeutic piece. And then really measuring, obviously, treatment outcomes, measurable goals and objectives that you can see achieved through, again, behavioral or attitudinal measurements that you approach within your treatment planning. Next slide, please. So some of the goals of the family therapist, again, must help families create a new and effective blueprint, like we talked about. Integrate new and old ideas, helping them find the balance. And I think that's always a compromise, right? With parenting, especially with adolescents and young kiddos that are kind of getting into their tweens and into their adolescence, their teenage years, a lot of compromise happens. And sometimes Latinx parents, and I've been, I think, guilty of this myself. I have to be aware, but I know my dad raised me very much on just do it because I said so. And there was no compromise whatsoever. Times have kind of changed, and I'm not saying that to a degree there still shouldn't be very clear rules and expectations. We know that young people thrive in structure, they thrive with rules, and they thrive with being a member of a family and a member as an important role within a family. Helping them to identify that as therapists and as providers, or as your role as a community agency representative, can be very powerful. And then again, helping folks effectively communicate, interact or connect with schools or the different systems that they have issues with. Even if it's child protective services, if they've been called because of a situation or a report from school or somewhere else, and now a therapist is involved in this, really helping them address that and work through that system effectively and with support. Next slide, please. And I believe that is it. And I'm going to go ahead now with our clinical case presentation of Marcela. Turn it over to Dr. Velez Echevarria. Thank you very much for your time. And of course, I'm going to stick around for any questions that you may have here at the end. Thank you for your attention.
Hi, everyone. Thank you for staying with us. I just want to remind everyone that this is a 2-hour webinar. And I also want to say that I'm really happy to be here. Thank you very much, Dr. Rocky Romero, for such an informative presentation. And this will help us understand a little bit more the case that I will be sharing with all of you. So today we're gonna talk about the clinical case of Marcela. I changed her name because I want to protect her identity. So I just want to make sure that everyone knows that. Next slide, please. So this was a 6-year-old girl that she was born in California, and her parents were from Mexico, both of her parents. She speaks Spanish and English. Her mom only speaks Spanish, and she was going to first grade to a public school in California, and she was living with her mom, but she also has some visitation dates with her father, 3 days a week. And one of the reasons that a little bit of the background of this family is that they received mental health services before because they experienced a lot of trauma and difficult situations that I will be going to explain. Next slide, please. So some of the difficult situations is that the youngest member of the family died in 2012. So for my clients and the whole family, it was a traumatic event. And my client also has 3 older sisters and the brother that passed away. Another thing that my client experienced was the separation of her parents because they separated after her brother died. Just as mentioned, the visitation days were 3 times a week, and the client, she presents a lot of stress and a lot of anxiety when she needs to go with her father. It was mainly because the father does not have that the parental skills that he needs to with a toddler almost, right? The main diagnosis of my client was adjustment disorder. Next slide, please. She received therapy since she was three years old. And before I was seeing my client, she used to have therapy in the same agency with another therapist. And she was using the trauma-focused cognitive behavioral therapy with this client. So this client has a background of knowledge that it was important for me as a therapist to know so I can use it on my sessions. I also actually like to explore what my clients knows about what is therapy, what is different kind of emotions, how we can identify different kind of emotions and their belief about therapy sessions. Because sometimes in the Latino family, there are some misconceptions actually about what is therapy or what we are going to be doing. Or also we can see in some parents that they can have like a lot of expectations that all the problems are going to be resolved in 1 or 2 sessions. And that is something that we need to clarify during our sessions. And I usually try to take a little bit more time doing that therapeutic alliance, but also providing psychoeducation to the families, because I try to use different questions, myths about therapy also, so they can understand what is therapy about and what we are going to be addressing in the therapy sessions. Before, the father was not included in the therapy session, and mostly because the past therapist was really scared about the father, and was mainly related to what the mom informed to the previous therapy about who was his dad, and that he was a violent man, that he was really angry all the time, and so the last therapist was really scared about the father, so she never connected with him. Next slide, please. So the clinical presentation, she experienced a lot of anxiety, and it was related to the dynamic between mother and father. She was presenting sadness, crying sometimes at school, sometimes when she was at home. She was presenting a lot of nightmares related to her mom passing away, or about her brother, and also about her father passing away. She presents some fears regarding that, besides the fear that mom or dad could die, that it was related to her brother passing away. She also had a fear of losing them, or thinking that they're never gonna get pick it up from school, or if my client was with a father, she was afraid that the mom could go to jail, and things like that. She has a lot of fear, but she presents usually during the therapy sessions. She was always smiling. She was like always really happy to be in therapy, and I think those are some of the strengths that she presented. She was really open to share her emotions and how she was feeling when she was with her father and with her mom. She also was grieving her brother's death. Just I explained on the anxiety, she was biting her nails usually. And also we need to address the trauma that she experienced. She was only 6 years old. So she experienced the separation of both parents. Father used to abuse alcohol and other drugs, but that was before she was born. And also the separation from both parents. We can see the next slide, please. I want to provide some information about Mother's background. So Mom was born in Osaka de Juarez in Mexico. And one of the things that I will do differently, and at the end I will explain a little bit more things that I will add to this previous case, because we know that as therapists we're always like learning new things and acknowledging more culture specific to different kind of cultures that we need to apply as we learn. And for this case, one of the things that I did not, that I would do differently, it was that I didn't ask about if the mom wants to express herself in their native language. So she speaks Spanish, but also she speaks another language that I don't remember if it could be Zapoteca or it could be Nahuatl. I don't know exactly because I didn't ask which language. But this is important as a therapist to ask if they have a native language besides Spanish when we are treating Latinx families, because sometimes to process some trauma events or some difficult events, it is better to express it in their native language. And then you can let them know that after they express that experience in their native language, they can express that in Spanish or in English. They can translate that information. So the mom, after she was physically and emotionally abused by her father, she was raised and she never went to school. She was working since she was a little girl, so she wasn't able to write or to read. And she used to work as a housekeeper almost 7 days in a week. Sometimes when she had more money problems, she worked 7 days, but usually it was 6 to 5 days. And because of this, it was difficult sometimes to schedule our therapy sessions. And her work itinerary changed almost like every week. That's one of the reasons also that impacts the therapy sessions. Next slide, please. About the father, so he was born in Osaka de Juarez, Mexico, just like as the mom. They never met before. They met when they moved to California. Father only speaks Spanish, and he had a history of substance use like alcohol, and I think it was also cocaine. And he was in prison in Mexico for almost 10 years because he got into a car accident when um, someone died. And because of that, he went to jail. And after he was released from jail, he was threatened that the family of the person that he killed was gonna, they were gonna kill him. So that's why that's why he immigrated to California, as he explained during our sessions. And while he was in prison, he said that he became a Christian and he started that recovering for substance use. And when he started living in California, there is when he met my client's mom. And during our sessions, I had sessions just like individual sessions with my client. I have collateral session just with mother and also with father, and also the family sessions with all the members of the family. And also I have sessions, co-joint sessions between mother and father. And when I was meeting with him, he was really open for a therapy session. He was like really engaging. He was like he needs to cancel. He was able to letting me know before coming to the session that I cannot make it today or I'm gonna be late today. So he was pretty engaging in therapy session. He used to work also as a construction worker, and because of his back pain, he stopped working in construction. So he wasn't able to pay the child support, right? So he was worried about going to jail again, being accused by my client's mother. Another stressor that he was presenting was that he was scared because sometimes the visitation was for mandated, right? Three times in a week, and sometimes when they scheduled to meet in a public space. So when he arrived there, the client's mom wasn't there with the client. And sometimes he goes back to his home without the client, without Marcela. So he was scared that because of the inconsistency of mom, he was going to jail again because he wasn't being compliant with what the judge said. So next slide, please. This case, I tried to do the 5 P's model. We have the presenting problem. It was Marcela was experiencing a lot of anxiety, but mostly that anxiety that we can observe in this girl was coming from the conflicts between both parents. And I want to acknowledge that sometimes the parents like talk about things that it's not okay for a 6-year-old to hear, and that is something that we address during therapy sessions. And there were some domestic violence between both of them. Mom called the police and said that the father was hitting her, but actually she informed me that he actually wasn't hitting her, that they were fighting and talking to each other, but without physical violence. But because she wants him to get out of the house, that's why she called the police and said that he was hitting her. So the predisposing factors which made the individual more vulnerable to the problems is the history of mental health conditions. Mom has depression and also experiences a lot of trauma during her life, and also my client's father. Low socioeconomic status, and when I'm bringing this, is because we know that a lot of our clients with low socioeconomic factors, they have a lot of risk factors in their life. So not being able to, for the mom, not being able to read or write, so that we add another risk factor. And also not to having like a space or the time to just enjoy her daughter or just stay at home with her is a factor, because she was usually working, trying to pay her bills and pay the apartments. We know Los Angeles in California actually is really, really expensive. So she used to work like a lot. And emotional instability at home made the client more worried about her family, what is going to happen. And sometimes she was worried, like, who's going to pick me up today? Or sometimes she's worried about who's going to pick me up from school. And also, she was also worried about her clothes. And this is something like mom says, I always buy clothes for her, and she left the clothes at her father's house, so I need to buy more. And we address this inside the therapy sessions. And this is something that I think is part of the engagement process with our Latinx clients. Is the agency that I worked before, they have usually they have a needs assessment during intake. And in this needs assessment, we explore if the family have furniture, if the family have clothes, if the kids have their own beds and things like that. And this family, actually, one of the things that the mom said that she wants is clothes. And we were able to provide donations for clothes and for mother and also for the father. And I think this is key for with our clients and Latino clients, like to check on the needs that they have. It's just like when I talk to my clients and I say, like, if you're hungry, if you don't have food in your house and you came here, and I can talk to you about, let's breathe in and breathe out, let's relax ourselves. But I cannot talk about those things if you don't have food in your stomach. You're gonna feel like that, right? We need to check and talk about the needs that our family has, and then we can continue working in other emotional and psychological issues, right? Next, please. Okay, so some of the precipitating factors was witnessing several episodes of domestic violence inside home. It was like mostly yelling between each parent, and her brother passing away. That was huge. Sometimes she was able to draw. She was really sad and expressed to me, like, I miss my brother. I want to be with him. He makes us really happy. So I let her know, like, it's okay to feel like that. I know, having in mind, right, what Dr. Romero explained about familismo. This is really important. He was part of the family, and she talks about him just like he was there, right? And we say, like, we validate her emotions. Like, it's okay to feel that way. I'm here for you. And if you want, what do you want to do with your feelings? Sometimes she chooses to, I want to write a letter, or I just want to draw something for my brother. And we talk about this. We talk about this with the mom, and the client actually was able to go to the cemetery with the mom, and she put the letter of the drawing there in the cemetery. So this is important also to address. Perpetuating factors were that both parents continue to argue like almost every time, every week. When when the father needs to pick up the girl, there was an argument. And me as a therapist, I observe and feel in some way how that my client was feeling, because I was almost sometimes in the middle. Sometimes the mom called me, like, he's not here to pick up the girl, like, I don't know what I'm gonna do. And the other way, the father, I was here and he wasn't here. So I was like sometimes in the middle, and I was able to process all those feelings with my amazing supervisor. So I encourage you as a therapist to also talk about these situations and these feelings with your supervisors, right? So the girl was presenting tantrums, but mostly the tantrums was of her father's house. And what happened at the father's house? He was really caring. He wanted to be in the picture. He wants to be there for her daughter. She was his only daughter, so he wants to be there for her. So what I observed was the father, it was difficult for him just to play with the girl. It was difficult for him to set some boundaries, right? And when she get upset sometimes because she needs to take a bath, and he didn't know what to do. She started saying, no, I don't want to. So father didn't know what to do when she started saying no. And sometimes he was like more rough, and then she started crying and calling her mom to letting her know what was happening. So this was a continued conflict. And in therapy, what we did is what we try to go step by step, like to do baby step with the father. And he also started to receive some parenting classes that it helped him to acquire some of the skills to be an amazing and great father, right? We can go to the next slide, please. Okay, some of the protective factors that we can observe and that Dr. Romero also explained are the familismo, spirituality. It was really strong for them. They were believer. The mom was Catholic and the father was Christian. A strong bond with mother. My client, like, she loves to be with her mom, but also after a few sessions, a few months, she also informed me that she enjoys to be with the father, and she started going to the park or cooking with the father. So I think that was some of the accomplishments that she had in psychotherapy. So she was really engaging. She loved coloring and also writing letters. And she was really she has a lot of empathy towards other people's needs. And I think that we need to acknowledge in our clients those strengths or predictive factors that are presenting, because it will help us to implement them inside therapy so we can reach the goal in a more easy way. And also to do of the therapy session a place where they feel comfortable, a place where they feel that they are safe also. Next slide, please. During the individual therapy sessions, I try to build a rapport with my 6-year-old, with Marcela. And with this, I take my time. I usually explore things that they like. I explore things that they usually try to do during their day, what they enjoy, and I try to bring those things to the therapy sessions. We also work with emotion identification. Like, it was difficult, and she was 6 years old. She was learning to identify different kind of emotions, and usually I try to use like different. I'm gonna show you like different teddy bears or stuffed animals, or also puppets, so they can learn about different kind of emotions inside therapy. It also depends on the age that they have. Also, this one, it's angry, and I try to let them know like how she's feeling, how do you think she's feeling, and how do you feel sometimes when you're angry? How do you feel that in your body? How can you notice when your mom or your father are angry? And she was explaining like sometimes they raise their voice, sometimes they start crying. So I try to do the psychoeducation about therapy and also psychoeducation about emotion regulation through our sessions. And because she has that background, because she received TSCBT before, it was a little bit more easy. And she almost knows some of the things like deep breathing. She already know how to do that. Next slide. With the collateral interventions, just as I explained, I have the sessions with the father and sessions with only the mom. We did find there was a lot of contradictions about the mom's narrative and also the father's narrative. So it was difficult for me sometimes to understand what was real and what was a lie. So they always have a lot of conflicts about that things. And this is something that I talk about during supervision session, because it was it was difficult. Some of the things that she said relating to the client, to the parenting, my client was, siempre nosotros chocamos y a veces digo cosas para defender a la nena. It's like, we always fighting and say things, but I always try to defend my girl because she was the youngest girl that she has. So she acknowledged, the mom acknowledged that that was one of the difficulties that they were presenting. In one of the sessions, we need to, because there was a conflict between who's gonna pick up, who's gonna, at what time and where. And we tried to create a contract explaining in a very detailed way, right, what we need to do to accomplish the pickup time and that everyone was happy, right? And we tried to write it down and also explain it to mom what we were doing, because it was difficult for her. She didn't know how to write or read. So I explained it to her, what was gonna happen at the time that she will be at the, sometimes it was at the train station, and when the father's gonna pick her up. So I just want to let you know that they break the contract a lot of time during the sessions. And one of the really important values that Dr. Rookie also explained was what is familia, and familia belief that the familismo means that belief that family comes before everything, before anyone, right? Familia viene primero. And this was a strong value inside this family, respeto, and also personalismo. Next slide, please. So here are the four components that I want to share with all of you of familismo. We're talking about, I'm gonna talk a little bit more about the structural family therapy, but familismo is really an important factor. Just how to explain, the family comes before anyone. There's interconnectedness between each family member. So as therapists, we need to acknowledge that and does not see that sometimes the boundaries are met, and believe that family reciprocity and familiar honor. So sometimes the oldest in the family have an opinion that is more valuable to the members, and sometimes when we don't have those clear boundaries, the whole family could run around the son, in this case my client, but she was the center of everything. So the family therapy intervention, just I explained, I incorporated father to the family co-joint therapy sessions for the treatment, because sometimes this is key. If both parents are able to be there and to help the clients to feel better and to address some of the anxiety symptoms that she was presenting, I am happy to have both of them. So be willing also to include some fathers in the therapy sessions, because I know that sometimes we don't think about the father, or we ask like, where is the father? Sometimes no, is there in his country, and my kid doesn't talk to him like in 3 or 4 years. But we as a therapist could go a little bit further and ask like, when was the last time? Do you think he could be included in the therapy session? Do you think he will be able to provide a little bit more information about our client, right? This is really important to consider. And we were able to provide support to family members, studying hopes and caring about their needs, just as explained, with acknowledging what they need. And usually it was clothes, mostly clothes was the main thing. And the agency also do like provide backpacks and things like that, and she was able to get a backpack with supplies and things. So it was a less stress for months by stuff for school. Also, during some of the sessions, we provide psychoeducation about effective communication, because seeing all these difficulties with the communication, we try to address that in one of the sessions with the whole family. So on the next slide, we can observe the different techniques inside the next one, sorry. The different techniques inside the structural family therapy. The next one, please. Thank you. So we can see the structure inside the different techniques inside the structural family therapy. And we can observe that there was a cross-generational coalition. What it means that mom and Marcela, they were against the father. So we need to address that coalition in the therapy sessions. It also explored what supports does the family have, and the family, they have from the mom's side, she has an extended family that was able to help her sometimes to take care of the girls, and also friends. And my clients also have some friends at school, so that's support for them. Some of the stressors that she experienced was watching her brother die. Her brother died because of cancer. So he died as a baby. He was like, I think 2 years old when he died. So for my client, that stress and that trauma of losing her brother was something that was alive on her. We observe some diffuse and also enmeshed boundaries, because sometimes the family runs around what the girl wants. Like she wants a toy, mom's always go fast and buy the toy that she wants. Sometimes the girl does not want to eat, mom say it's okay, you don't need to eat, right? So we try during the therapy sessions to acknowledge and talk about those boundaries and talk about what are boundaries and how we can set those boundaries so the client could be more clear. And also for father, I think that it was a little bit difficult. In one of the sessions, I tried to ask to the client, like, do you know about the rules that you have at your mom's house? And she said, yes, I need to take a bath, I need to do my homework, and I need to pick up my toys. So she said 3 things, right? When we were talking about the rules that she has at that house, she was like thinking she took a lot of time, like, I don't think there's any rule. I don't know. And the father was like, yes, we have rules. So addressing that, the rules inside the house is also important, because the rules were there, but the client didn't know. And the father said, yes, you need to pick up your toys. You need to do your homework after coming, and you need to, the other one was eat your food. You need to eat the food. And after father explained to her, like, she was like, okay. So I think this is important to acknowledge. What are the house rules? What are the house rules that we don't talk? And what are the clear rules that we have in our house? So the structural family therapy, the main goal of this is to intervene to transform the structure, to diminish the symptoms, and promote a healthy development or growth of individuals and also the families. And the main phases include, the first one is to build the therapeutic alliance. And this is what I said, I tried to take a little bit more time building that therapeutic alliance with family members and also with my client. Evaluate and access the family structure and the boundaries that are there and the hierarchies, right? Here in the hierarchy, like, the one that have a little bit more control over everything was that girl, because both mom and dad runs, they were only paying attention of what the girls want and not what they actually want. And then the third step, or the third phase of structural family therapy, include addressing main problems in the identify and the assessment, right? So we were able to have those family sessions where some of the sessions were recorded, and because I use it through my supervision, but also one of the sessions that I think that was really, really meaningful for them, it was when we talk about different type of communications, right? And I did like a drawing, and I showed to them just to be a little bit more visual and more engaging. I showed to them like a face of a dragon for an aggressive communication, a face of a turtle for a more like passive type of communication, and a picture of a person just to demonstrate an assertive communication, right? I informed them different type. We did some example, different type of communication. And also she was the girl. After that, the girl she draw a drawing about something that she wants to communicate to her parents, something that she wants to say to her parents. So we can see it on the next slide. So this was the drawing, right? So she is the purple one, the little one. The mom is a little bit taller with the purple, and the father was in the middle. Okay, so she said to the parents, "I love you, but can you take a rest while you're talking?" And it was so powerful. And when we were talking about the drawing, she felt a little bit scared to say that to the parents, like, "I don't want to share this." And she was like, "I'm gonna be here with you. If you want to do it, it's okay. If not, okay." And she says, "Yes, I want to do it." So when she explained this to the both parents, they were like, "What? What is happening?" And they were, "Why you're saying this?" And it was mostly because they were almost always fighting when they were talking to each other. They were not talking, they were fighting almost every time. And when the girl was with mom was talking bad about the father, and when the girl was with the father was talking bad about the mom. So we addressed that also in our therapy sessions. The next slide, please. I know that structural family therapy, we can implement it with our Latinx client, right? And this is an example of a demonstration from Salvador Monitoring. And it presents a case of a 10-year-old boy that was hospitalized. And at the beginning, I'm not going to put the whole video, just part of it, but I just want to acknowledge that he is amazing. He was amazing, right? Providing the structural family therapy. He was the developer of the therapy, and I just want you to watch this piece of the video. I hope you enjoy this. We cannot hear the audio. I don't know if you can put the caption, please. No, we cannot hear.
First, personal, tourism, structural analysis, preparation,
I think that would be better.
The boy was older, the boy was fine, different in which the father responds, different is his response to her.
So it's okay, we can put some. Thank you. So what he was trying on that intervention was to reframe the situation, right? And the question that he asked was, why mom is not here and you are here in this hospital, right? And at the end, he explained that and view the situation from a different perspective. And he explained like, you're here because you are having problems with your behavior, but also because mom does not know how to handle this. So then he explained this is a two-way situation. Your moms need to improve also at the same time that you need to improve. So it's not the kid is the problem, he is the one that needs to get better. He addressed that mom also and the father that he was really disengaged from the situation. Also the mom needs to improve and educate herself so she are able and more capable to take care of this kid, right? And I encourage you to see the whole video because it's a really good presentation of the techniques of reframing and also acknowledge different boundaries in the family. So we can go to the next slide. I'm so sorry for the audio. I don't know what happened. So some of the accomplishments that I will say that my client had during session, it was that she increased her emotional vocabulary, and she feel more open to discuss her emotions with father and with mom. Also, she was more calm and more excited to stay with the father. We made a referral for Project Fatherhood. This project. I think there's in different agency, but this project helped the father of my client, to acquire more skills of how to parent her child. But at the same time, they have some activities where he can go with her daughter, so they can have they can strengthen their bond as a father and daughter, right? During this therapy, we provide psychoeducation. We were able to set a little bit more clear boundaries and acknowledge them, right? Because sometimes I didn't know what was happening, so acknowledge the boundaries that they were there, and also trying to identify them and help them to establish more healthy boundaries. Marcela was a little bit more open. At the end, she was like more happy about the way the father was addressing the client's behavior, because he learned how to negotiate it. He learned how to use other type of disciplinary, like take away privilege, like some toys, or going to the park before doing the assignment, homework, things like that. And also the identification of family patterns. I did a genogram with the father as a way to explore his background and this story, because he had a lot of brothers, a lot of situations, and I tried to use the genogram as a way to see everything in a place, and how was his relationship with his parents, his relationship with the clients, with my clients, and also check about some trauma history there. And the next slide, we can go to the next one. And some of the challenges that I want to address that I observed, it was like difficult to have the consistency inside therapy session due to the word, to miscommunication, engaging both parents. In some way, it was kind of difficult for them to be in the same room. But after a few sessions, I feel like a little bit more comfortable, even if they sit like really separate from each other. They were able to be there for my client, right? Incorporating the father, and my supervisor said, we need to do this. We need to include the father. He's part of the structure of the family, right? And we need to check how we can help him and how we can address the difficulties he's presenting, so my client's anxiety could decrease, right? That's the main focus of the therapy. And I want to let you know that also when we include fathers inside therapy, it would help our client to decrease some of the symptoms, right? Where we need to be really careful, right? Because if there was like really violent person, like it will not help our clients. We need to evaluate the situation. The next slide, please. So illustrating how the history of their parents' history, how it impacts the actual behavior that they were presenting, also how it impacts how they were parenting Marcela, and the miscommunication and sometimes lie between each other. That was another difficult situation during therapy sessions. And the next slide. So I want to provide also some of the resources that it will, like if I have this case right now, it will be more helpful to have those resources, right? I try to identify which one we'll need. So we can go to the next slide. What are the things I will do differently? What are the things that I could improve with this client, right? And one of them is to use the cultural formulation interview. And I will obtain so much information about how the parents see the situation and about their words they use to describe the client's symptoms. This is a very good instrument that you can implement while you're doing the intake with your clients. Recognition of cultural values, how they influence the parenting skills, and also try to use an assessment tool to explore the assimilation and also acculturation level that the parents were presenting, right? And also the father was taking parenting classes, but I will refer both of them to parenting classes also. But at the same time, I will try to find a way where the both parents can have their individual therapy. But I think at the time they were undocumented, so they didn't have health insurance at that time. And I will do home base because it was difficult, or in this case right now, telehealth. They were having so much trouble to go to the agency, so I will do a little bit more home base, and I will add some school visitation to get a little bit more information about my client's behavior inside the school. And I know she was having good grades and no problems at all, but I think that adding and checking the school environment, how she was behaving in school, it will provide a little bit more information that will be useful during assessment and to reach the therapy goals. On the next slide, this is one of the tools that we have on our website of the National Hispanic and Latino Mental Health, MHTTC. This one is the fact sheet. It's just like one paper to side information regarding the cultural formulation interview that you can implement while you're doing your assessment. The next slide is just another fact sheet that can use where it talks briefly about the different cultural values that will provide you more information. And the next one is about how to address complicated grief in Latinx families. So you can have knowledge about the main concerns or somatic symptoms they could present and things like that, and how to address in their family. You have it on the handouts box. That is a copy of this presentation, so you can download and you have all the information you can check on. The next slide. Yes, on the next slide, we have the cultural formulation interview project from the New York Cultural Competence. There, as a therapist, you can have a training about how to do the cultural formulation interview, but also you can see some examples of how Dr. Roberto Lui do some of the interviews using the cultural formulation interview. So the next resource is the father paternity different way in being involved. This is this is a tool for parents, and I think it's Spanish and English also, that you can provide to them and to help them how to be more engaged with the kids, for the kids. And this is a link of Project Fatherhood. That is an amazing project that is helping a lot of fathers to be part of the therapy session or part of the life of a lot of kids. So the next slide is just a video that you can see that it talks about the Project Fatherhood, and this is one of the activities that they usually do. So I think that the most important thing here is like you as a therapist being there, being transparent to your clients, and try to explore what are the things that will help you as a therapist, and what are the things that will help your client to feel more comfortable inside therapy sessions, to be more engaging in therapy session, and also what is going to help them to reach their goals. And do not only seeing your client as an individual, but also thinking about the familismo, seeing them as a system. It will help us to structure the system and provide the resources they need. So thank you for all the therapists that are there doing an amazing job with Latinx clients. I know you are doing great, and I know this is a difficult time too. And thank you, everyone. And now we are open for some questions.
Thank you so much, Dr.
Hi, guys,
Romero and
can you
Dr.
hear me?
Velez. And Marie will do the questions.
Can you
Yes,
hear
we
me
can
all
hear
right?
you.
Okay,
Yes,
thank
we
you,
can.
Dr. Velez and Dr. Romero. We have a couple of questions. The first one being, when measuring familismo, do you recommend using genograms?
This is Rocky. I'd say again that that's part of probably the initial intake and gathering of information. You want to try to establish that sooner in the process than later, so that you know what type of family dynamics you're working with, what relationships are protective in terms of falling in line with protective factors, and then you may also have some family members that may align more closely with risk factors or toxic type of relationships. So I recommend, and of course I'll defer as well in terms of other feedback, but I would do that as part of the intake packet and within the first few sessions, if at all possible, as you're developing rapport. And usually if you kind of tell people, tell me your story, tell me about your family, and you can kind of get a natural conversation flowing that way, as opposed to kind of going systematically through each family member, but then summarizing that at the end by saying, again, as I'm understanding, this relationship with so and so is enmeshed, or it's broken, or there's no contact, and you can kind of map it out that way. The other thing I like about the genogram or eco mapping is it's visual. Our Latinx population, people of color, typically tend to learn better through a tactile kind of approach and visual symbols. So anything else that you would add, Dr. Velez?
Yes, that we can use the genogram to explore familismo, and acknowledging that you can explore the relationship between us of other. You can use the genogram to explore spirituality. You can use the genogram to explore medical conditions and trauma events. So there's different things that you can explore using the genogram. So yes, I would recommend it. Next question.
I have one question. How do you manage a situation in which child only wants to speak English during session, but parents only speak Spanish?
I can answer you. So what I will do, I would say that it's okay to speak in English, and also to encourage the client to translate if he wants to, or I can translate. Because if he's using English, it's because he feels more comfortable expressing himself in that language. So I will try to help them to, or encourage him to translate, or I can translate for him.
And I would just add to that too. I think that's an excellent response, and looking at it from kind of what's the underlying reason, right? Sometimes I think we see young people wanting to use English more because they feel like they're more connected to American society, and they want to be more American, and whatever that looks like or means, right? So I think it's also kind of reframing that for them and saying, just because you speak Spanish, or we speak Spanish in the session so that we're all communicating effectively, that makes you twice as strong, right? You're able to communicate in English and Spanish. So maybe compromising, right? Trying it on and saying, how about for one session we talk in Spanish, and maybe the next we practice our English. And I think there's ways to integrate that to where you're kind of building it into exploration of what are the reasons why, and maybe even mastery, right? Of helping them to master English if the parents maybe struggle with that. So you can kind of help them to teach each other, if you will, reciprocity and learning as well.
Another question is, what would you recommend if both parents and adolescents are resistant to get involved in treatment together and having family therapy sessions?
I guess for one thing, I would say, like from a clinical supervisor and agency perspective, is there any external pressure that will help you to get them there, right? And by that, I say that cautiously, given what we know about probation and parole in courts, and how sometimes people of color get treated much more oppressively than their white counterparts. So I always say this with a grain of salt and carefully. If you have some external pressure that you can use to say, if you don't come into therapy, and it may be, again, we have a right to inform, right, and a right to report, the duty to report. If they're a party to a petition, court-wise or otherwise, and you have to report that back to the courts that they are not participating, then you have to be clear in utilizing that. The other way that I would do it is sometimes feed them and they will come. You know, you offer different ways and different incentives and resources to get folks to kind of come to therapy and to come in. And then I think it's also about the personalismo, is calling and inviting them and saying, we really want you to be here. We think it's important. You're an important member of the family, and really building that personalismo, like I said. And I think that's a really good starting point, and usually you can get people in that way. Anything else to add, Dr. Velez?
Yeah, you're right. I will do the same thing. And also, one of the things that I could address is like why they don't want it to be in family therapy, you know, because they feel scared, they're not safe, they do not know what we're gonna do, because a lot of people watch a lot of TV shows and novelas and a lot of let's say muñequitos and things like that, and they have a conception about what is family therapy that actually is not. So maybe exploring what they think it is family therapy, and also maybe letting them know like a specific structure that we can do inside a therapy session. It will help them feel a little bit more comfortable, maybe, or more able to be in a family therapy session.
I have one last question that says, what are some ways that you could create that warm and inviting invitation for family therapy with telehealth? Sometimes there is an infant or lack of privacy, and that has been challenging for me. So I am looking for some creative ways that clinicians have found success.
Okay. So I think the question was how to create a warm environment and inviting environment using telehealth, right? So I think that's a challenge that you're presenting, the person that asked the question, and a lot of providers we are presenting right now. And actually more when you have little ones. I have a 4.5-year-old, and it is difficult to engage her in therapy using telehealth. So one of the resources that I try to use right now with this client, I'm trying to help her identify different kind of emotions. So for that client specifically, I'm using like different inside out movie YouTube videos that explain different emotions. And for her, because she loves movies and she loves to watch TV, maybe using that type of video will help her to be more engaged. So for the warm, I would say for me to let her know that the information that she's sharing, I am in a private place, that no one is gonna listen to her, just me. Sometimes I'm with my headphones on. I let the mom knows that, can you please, I text her the day before, remember tomorrow we're gonna have a session, it will be at this time, and during the session I will be presenting a video about this, or we're gonna do this. So I want you, could you let her know, for the client, right? So moms could prepare my client before I met with the girl, and she can also schedule on her mind, okay, we cannot start watching a movie, because she did one of the times she started watching a movie and it was supposed to be our therapy session and she was watching a movie. She didn't want to be in therapy. So that's why I started to using that to remind the mother what we're gonna do so she can prepare the client. I think being active listening is another thing that we need to be like. You can move forward to the camera, and that will help the clients feel that you are you're really into what the client is saying and that you're really there. For using the phone is more difficult, but one of the recommendations while you're providing therapy through the phone is just to be in a quiet place and just close your eyes as a therapist so you can really hear everything while you're client and focus on what your client is saying. That will be some of my recommendations. I don't know if you have someone's Rocky.
No, I think that's excellent. I agree that it's challenging and it's difficult. Some of the things that I usually tell folks, especially with phone and now with telebehavioral health approaches, is make sure that you give me a phone number that only you have access to. If I do get a voice message, do you want me to leave any type of identifying information or solely? And usually I keep it very brief. This is Rocky. Please give me a call, and I leave my number. I don't go into, this is Rocky and I'm calling from Inside Out Therapy and your therapy session. I don't go into all of that just because maybe they're not comfortable yet. Maybe they, and I think each client, even our adolescent clients and young people, they deserve the privacy that we provide to any other client, and we should provide that privacy again within legal ramifications, right? In terms of duty to report and warn and all those things. But young people and teenagers, they have a right to privacy too. And when we're communicating with them, I think giving them these tools, put on your headphones, get in a warm or a quiet place. Some of our folks that really have a lot of family members, and we see this a lot at our at the reservation in McKinley County too, where family members, especially now because they're restricted from going outside, right? So they have to stay home. Some of the clients are actually going out and sitting in their car and doing the session in their vehicle just to get away. It's private, you don't have the surroundings and the outside noise. So I think just being creative. I think I always tell my clinicians that I supervise, always remember it's your license too, and it's very difficult now with telehealth. We have to be cautious in what we have in our background of our room, in our office. If we don't want people to see certain pictures or certain things in our office, make sure that you're looking around your space if you're doing telehealth, and knowing what you want to expose your clients to. In the instance where we have someone that's violent or maybe gang affiliated, sometimes having pictures of family members or other things may not be the best. And so again, just know your environment, know your population, and set up your kind of office setting so that it's comfortable and that you're not stepping on people's rights and privacy rights as well. I think that's all. Thank you.
Thank you, everyone.
Thank you, Dr. Romero and Dr. Velez, for a wonderful presentation. Please remember to fill our evaluation form. Here's a barcode you can scan with your smartphone, or you can click the link. If you don't do it right away, you will receive an email with the evaluation link. Thank you so much for your participation.
Thank you all, Dr. Velez.
Bye, thank you.
Bye.
Bye-bye.
Bye.
Bye.